The Nigerian Senate has taken a significant step towards strengthening the nation's healthcare system by considering a bill that seeks to increase the basic healthcare provision fund from 1% to 2% of the federal government's Consolidated Revenue Fund. The bill, which passed second reading on Wednesday, seeks to amend the National Health Act No. 8 of 2014 to ensure improved healthcare financing and sustainability amid dwindling donor support and rising health demands across the country. Sponsoring the bill, Senator Dr. Ipalibo Banigo Harry of Rivers State, who also chairs the Senate Committee on Tertiary Health, said the proposed amendment is a crucial intervention to bridge Nigerians' widening health funding gap. She lamented that the existing 1% allocation is no longer sufficient to sustain critical health programs such as immunization, maternal care, and disease control.
It represents Nigeria's first statutory mechanism for sustaining health financing. However, with increasing service demand, stagnating donor assistance, and persistently high out-of-pocket expenditure, now over 75% of total health expenditure, according to the National Health Account of 2022. The 1% allocation has proven insufficient to meet national health needs. Recent fiscal threats further underscore this concern. The withdrawal of the US government support in key health programs and Nigeria's approaching transition from Gavi, the Vaccine Alliance, mean that the country will soon shoulder greater financial responsibility for immunization, maternal health, and disease control. Without an increase in domestic financing, these developments could erode the hard-won gains in child survival, epidemic preparedness, and universal access to basic health care. Therefore, increasing the basic health care provision fund from 1% to 2% of the Consolidated Revenue Fund is a strategic and timely intervention.
Healthcare delivery in Nigeria cannot thrive on insufficient funding. Increasing the BHCPF to 2% will guarantee predictable resources and strengthen service delivery, especially at the grassroots. Supporting the motion, lawmakers across party lines described the bill as both timely and essential, stressing that health remains a constitutional right that must be adequately funded.
Supporting this bill against the background of the fact that the United States of America has drastically reduced their aid funding in the health sector. And there is also donor fatigue amongst other international organizations, international aid agencies that normally support all this HIV, malaria, tuberculosis, and what have you. There is donor fatigue. And the United States, under President Donald Trump, has withdrawn support for all these health-related endeavors. So against this background, there is need for us to increase our funding from 1% to 2% for the health sector.
Senator Tahir Monguno said we cannot continue to rely on donor funding. Strengthening our primary health system begins with proper local investments.
This will enhance our primary health care system, encourage universal health coverage. Mr. President, health is too serious to be left to Nigerians, especially in the face of poverty. In a lot of the developed and developing world, especially the developed world, I know in Canada, healthcare is essentially a government thing. You hardly find private hospitals. That shows you that this sector, this area, is too important to be left to the individuals, especially in poor countries like Nigeria. Mr. President, today, we have a situation where citizens and our constituents resort to quacks resort to prayer houses. Mr. President, I want to also say clearly that I believe in the efficacy of prayers. But in what is happening today, our people are driven out of poverty to these prayer houses in issues that can be handled, especially at the primary health care level.
This increment is a statement of commitment to our citizens that health is not a privilege, but a priority.
Senator Ashiru, representing the good people of Kwara South, I stand to wholeheartedly support the second reading of this important bill. I look through, and my first observation is that the chairman of Health Committee is not asking for more money. What he's asking for, really, is that greater attention should be given to preventive aspect of our health system. And like he rightly couched it, he said, this is where mothers give birth, children are humanized, and diseases are detected at an early time. My feel is that if we take care of preventive aspects of our health system, we spend less money on the curative side. If we take care of the preventive side of our health system, what it means is that our population will be healthier and their productivity or contribution to economic prosperity will be greater.
When we invest in health, we invest in productivity and national growth. The time to act is now, said Senator Lola Ashiru. Senate President Godswill Akpabio commended the intent of the bill and referred it to the State Committee on Health, Tertiary and Secondary for further legislative work. The committee is expected to report back within 4 weeks.
Distinguished colleagues, a bill for an act to amend the National Health Act number 8, 2014 to increase the basic health care provision fund from 1% to 2% of the Consolidated Revenue Fund and for related matters 2025, second reading taken. This bill is referred to the Committee on Health, Secondary and Tertiary to report back to the Senate within 4 weeks.